So my name is Amy Way, and my program is Health Science. So we teach all things health in here, from careers to diseases and treatments. This is our lab, and we learn how to make hospital beds in here, with patients in the beds, without the beds. We learn vital signs, blood pressure, pulse, temperatures. We do CPR. Everybody that comes through this program has a chance to be CPR certified. And so that's a chance that you can save a life, even if you don't even choose to go into the medical field. Health, is going to follow you your whole life, as long as you stay in that body. So the main goal for this program is just to enrich students' awareness of health in their own body, first of all, and in the bodies of their families. Because like I said earlier, health touches everybody as long as you're in a body. And so I want people to be aware of how their own body works, first of all, and then to give them a desire in the numerous careers that you can go into, from dental to veterinary to doctors, nurses, pediatricians, surgeons, to see if that's something that interests them after graduation. Well, I think I kind of make the health science program unique, because I'm a pretty unique person myself. And I think that what makes us different, we are hands-on. We do.
Always been strangely interested with teeth, especially the idea of cleaning them instead of drilling into them. So when I found out there was a job to be a dental hygienist to clean your teeth, I was always so excited to go to the dentist.
Of course, you have to use a stethoscope to check someone's blood pressure, and we utilize our own bodies just to check pulse on each other. We use thermometers. We have sat monitors that help us with the oxygen saturation in people's bodies. Yeah. Well, I think that the best way for students to understand professionalism is for me to example that. And so I try to dress professionally every day. I do love colored fingernail polish, but when I'm in my uniform, I don't have my nails polished. I have minimal jewelry on. My hair is always up so that it's not getting in any kind of patient's face while we're making the beds.
I would say the CPR lessons, every single year we have it, and I like getting up and pretending there's a scenario.
So this course here in high school is just a foundational look into several different careers. So I have a foundation class that everyone must take, and then a second level class you can take sports medicine. In sports medicine, we go out to the practice fields and watch them practice. We learn how to tape in that class. Then we have pharmacy. Pharmacy, you can learn different aspects of medications and how to calculate those medications. Therapeutics is just a class that encompasses a lot of different careers, like therapy, dentistry, and then our last class, our senior class, patient care technician, you can actually get a certification and graduate from Russell County as a patient care technician. What am I most proud of my students? So one of the things that gives me satisfaction here is when a light comes on in a student's head, when they, are practicing blood pressures and they actually hear the blood pressure, or they're trying to find somebody's pulse and they actually can feel that pulse. That's exciting to me. Okay, so that's it. So one of my biggest success stories is a student came in this class, and a lot of times people are just put in this class. They don't necessarily aren't interested in healthcare. There's just nowhere else to go. I don't know if you guys have experienced that. But so I had a student, he came into this class, and he was a good student. He did the work, but he didn't ever seem interested in what we were doing.
We've done little mini lessons with hygiene, or at least with teeth and dental things. There's like little fake teeth around. And it taught me that I really, really want to pursue this as a life choice for a career. And it helped me get, accepted into Columbus Tech and wanting to get scholarships.